I was alone in the hospital, and I guess that is where it sunk in. That was gonna be, that was it. I lived on the streets, I'd lost my home, my kind of kids, the wife, the whole thing, the career, all of it. It was going nowhere, basically. And then pretty much the choice happened, I think. I think that was the first time where I actually meant that choice to be sober and was fully willing to do whatever it took, like that one last Hail Mary. And that was kind of my first experience with CUPS.
CUPS has been working in the Calgary community for over 30 years. Our focus and our vision has always been on how do we better help the clients that come through our doors. Through integrated care, we're able to assess the whole person and really identify the needs that they specifically have. Through our community partnerships, we're able to provide a seamless pathway to an extensive array of programs and services. With over 180 staff and over 40 programs and services, CUPS gets to the root of the problem and builds resiliency.
I'd been around the program for a while, and I'd known that I was out there, and I wanted to be clean for quite some time. But I was just kind of the monster that it is. And I guess when a moment it all really went bad is it was the morning before a children's service meeting. And I was at my wife's house in my river, and I OD'd in the bathroom. I died 3 times in those last 2 weeks. I can't even remember all of them. To be honest, I was probably only thinking about myself, really. I don't know what happened, when it was, but up until one day when the choice was made, I was fairly confident I wasn't making it. Like it was, I'm going to, leave my children without a father. Which, looking back now, I can't even see that person anymore. And it's just, there's a lot in life now. It's not, it's not so hopeless. So there's a lot to live for. You had to have a starting place. And for a lot of the people, this was the starting place. A lot of us got different medications, different help, different mental health. We had parenting programs. We had it all.
CUPS believes in an integrated, holistic approach to client care. When an individual first comes into CUPS, they have an opportunity to sit with a care coordinator. Using our Resiliency tool as a guide for conversation, we start to identify areas of concern as well as areas of strength. For example, someone may come in and identify housing as their main area of concern. But through further conversation, we identify that maybe counseling, a clinician, or child development services may be appropriate to put a care plan together so that they can move on towards building resilience.
At the time I came here, I had no ID, no Alberta healthcare. I just didn't have anything. So, immediately just getting in the door was far more than anything else I could have had. They directed me to quite a few things. It was a doctor from here that would delivered our girl. I think I even got a sandwich here once, like there was food, there was just everything, right? I needed all the services this place had, they had housing, they had options. I encountered mental health issues that I was unaware of and undiagnosed with, and through coming here and actually having a doctor and communicating with somebody that I was able to trust and having that managed as well as it can be, those programs and that assistance, changed me quite a bit. It really was kind of a one-stop shop for me. Everything we needed was here. We have services even to this day that are still going, supporting the family.
CUPS Family and Child Development Programming takes a 2-generational approach. This means working with parents and children. In order to make the biggest impact, it's important to work with the whole family to ensure that children are developing appropriately, parent-child relationships are strong, and families have what they need to thrive now and in the future.
Life now, is at home with the wife, our 3 children. We recently moved into our own place as of December 7th. It's pretty exciting. About 2.5 years clean, you know, it's a clean house, good environment. I've been working, completed school, completed treatment, completed first year of welding. Honestly, in the long run, my dream's pretty simple. I accomplished my dream already. I accomplished that when I got home and got my kids back. Like, my biggest thing is just try to be the best dad I can. Work hard. The rest will come. Like, none of it ever happened without here, really. CUPS has kind of touched almost every aspect of our lives, really. We've had a great experience with all the people. They became almost family-like to us. Anything, you know, they were there. And that is why I still come here. They're here and they care. That's basically it.
CUPS helps in excess of 8,000 individuals and families each year. In this economic downturn, unfortunately, client needs go up while resources become more limited. As we continue to develop out our integrated care plans and our community partnerships, your support is needed more than ever to help us build a resilient community.